and sperm remain. The egg is covered with a layer of cells called the corona radiata. The sperm must push through this layer to reach the outer layer of the egg, the zona pellucida. When sperm reach the zona pellucida, they attach to inside the egg. The tightly packed male genetic material spreads out. A new membrane forms around the genetic material, creating the male pronucleus. Inside, the genetic material reforms into 23 chromosomes. The female genetic material, awakened by the fusion of the sperm with the egg, finishes dividing, resulting in the female pronucleus, which also contains 23 chromosomes. As the male and female pronuclei form, spiderweb-like threads, called microtubules, pull them toward each other. The two sets of chromosomes join together, completing the process of fertilization. At this moment, a unique genetic code arises, instantly determining gender, hair color, eye color, and hundreds of other characteristics. This new single cell, the zygote, is the beginning of a new human being. And now the cilia and the fallopian tube
surface transport the egg to the entrance of the fallopian tube. Inside the walls of the fallopian tube, muscular contractions gently push the egg towards the uterus. After ovulation, the egg lives for 12 to 24 hours, so it must be fertilized by a sperm from the male during this time for a woman to become pregnant. If it's not fertilized, the egg dissolves away and is shed along with the uterine lining during menstruation. Such as perpendicular to the birth canal or buttocks first, which is the breech position. Placenta previa occurs when a low-lying placenta partially or completely blocks the cervical opening. Fetal distress occurs whenever the health of the baby is in imminent danger, usually from inadequate blood flow through the placenta or umbilical cord. Fetal distress can occur when the placenta separates from the wall of the uterus prior to delivery or the umbilical cord becomes compressed or squeezed. Other conditions that may require a cesarean sound testing and a fetal heart monitor to help decide whether your baby should be delivered by cesarean.
And your baby's head has moved beyond the cervical opening into your birth canal. During this stage, you will begin to push your baby out. You may instinctively push when you feel the urge, or you may need coaching from your doctor, midwife, or labor nurse as to when to push and when to rest. In a normal delivery, your baby's head will rotate to face your back. During active labor, your uterus is divided into an active segment that contracts, pushing the baby downward, and a flexible passive segment that remains relaxed, stretching to provide more room for the baby to pass through. In some cases, when the top of your baby's head appears or crowns, your doctor may make a small cut called an episiotomy to enlarge the vaginal opening. Then you will continue pushing your baby out. As your baby's head passes through the birth canal, it molds into an elongated shape. An elongated head shape will resolve itself within a few days as the skull bones shift back into place. After your baby's head exits the birth canal, his or her head and shoulders will rotate to help the shoulders pass through the birth canal. Your baby's shoulders are delivered one after the other in order to fit through your pelvis. Once the shoulders emerge, the rest of your baby slides out easily. After your baby is born, his or her umbilical cord will be cut. In stage 3 of labor, which may last 5 to 30 minutes, mild contractions will help push the placenta out of the uterus. During this stage, you and your baby may begin bonding.